Okay, first of all, just tell me who you are and the organisation you represent.
Okay, my name is Pendo Maro, and I'm here to represent Healthcare Without Harm and Health and Environment Alliance. So these are organizations working on environmental issues and health issues. So basically we're here because we're concerned about climate change and health. And we've brought together a group of medical professionals to come here today to give the message that, climate change is not just an environmental issue, it's also a health issue. It's going to impact health. But if we address climate change, we have a lot of benefits for health. So our message is kind of like what's good for climate is good for health.
Okay.
And we also believe that medical professionals are very trusted people. They're very trustworthy. I mean, they're neutral in this process. They stand to gain basically nothing. And what they're coming to do here is try to act as, well, not trying to act, to bring forth this health message and trying to convince negotiators or everybody here really just to share this message that climate change concerns you and me and everybody else, So health is generally the issue here, and whether we tackle environmental issues, whether we tackle reduce emissions or whatever it is we're talking about, we must realize that we're all going to suffer the consequences. So let's all get together and try to see what we can do.
I mean, can you be specific about the health effects on the population from climate change? What kind of things might people suffer from?
Well, apart from increased disease, but I have here Dr. Mike Wilks, and I'll let him carry on that angle. So we've got diseases, kind of like the spread of diseases such as malaria, simply because weather is changing. In the mountain areas, we have cases already in Kenya, we have Tanzania, we have things like the temperature extremes we had in Europe in 2003, a heat wave where a lot of people died in France and in other parts. And most of the people that are affected by this are the vulnerable, the elderly, the children, the very young, the poor who have no access to medical care. So health, what I'd like to say is that so it's impacting on different parts of populations, but the ones who are suffering more are the most vulnerable. And what we're trying to do is make sure that all these impacts of climate change are taken into account, as well as the benefits. In Europe, we've done a study, Heal and Healthcare Without Harm, looking at what would happen, the economic benefits of the EU's moving from 20% emission reduction target to 30% emission reduction target. And here we find that we have some economic benefits, some savings of up to 30 billion euros per year, each year from 2020. So, apart from just the health benefits, we've also got a huge economic benefit. And in the time now when we have budget deficits, when you've got economic ministers looking to cut budgets in many parts of Europe, I think this is a very legitimate issue to bring forth to the table and to try also to show people that it's about health and it's also about the economy. So it's good for health and it's also good for our economy.
Okay, thank you. So,
Thank you.
Dr. Wilks, is this message finding some kind of resonance so far among the negotiators here?
It's beginning to. If you look at the draft texts at the moment, health has managed to achieve the notable position of being a footnote somewhere on one page, so we've obviously got a way to go. I'm a physician working in the UK, but I'm a board member of Healthcare Without Harm, and I've also been involved with medical organisations in the EU, and I think that what you will hear at so many meetings here is an understanding about the risks to health of climate change, vector-borne diseases, unfamiliar diseases in new places, disasters, flooding, heat-related deaths, and we can go on banging that message, which is really important because we need mitigation adaptation policies to deal with some of the inevitable health consequences. But what we need to make more play with, and we're beginning to get some understanding of this. What's interesting, as soon as we explain this new narrative to people, it's like, oh, we didn't know that. And the narrative, as Pendo says, is simply this, that if you reduce greenhouse gases, you get healthier people. And the cost of actually reducing greenhouse gases is largely met out of the health savings you then produce. So as Pendo says, the latest study that was done by Healthcare Without Harm and Heal in relation to the EU, that £30.5 billion extra saving per year on health that you get by going from 20 to 30% greenhouse gas reductions, two-thirds of the cost of doing that is returned in your healthcare savings. So it's a fantastic investment. And of course the other thing is, if you look at it in purely economic terms, which many people may find attractive even if they're climate change skeptics, is that it's something that's worth spending money on. I mean, who's not going to argue with people being healthier? And you can apply this to any country in any kind of political view of climate change and still have a good argument. And you can also apply it at the personal level right up to the global, because at a personal level, if you reduce your meat consumption, you take more exercise, you will benefit yourself by really an amazing amount. You reduce your risk of heart disease and stroke. And we don't know some of the mechanisms for this, but we know that fitter people have a lower risk of dementia. We know they have a lower risk of breast cancer in women. We don't know why necessarily, but it's a fact. And then you push that up to the national and then the global scale, and what you will then be able to argue is that it's well worth spending money on greenhouse gas reduction because you get a healthier and economically a more productive population. And we need to keep pushing this message. It's beginning to gain some traction here. I suspect it will not affect the outcome here, but it's something that we need to widen our collaboration. For instance, this is not just a health argument, but it's an economic one, and we need to work with other interest groups to push the economic message.
Is it gaining traction among the other interest groups? Is it gaining traction among the politicians sitting a few kilometres away from here?
It does when you sit down and explain it to them. They haven't come here with that understanding, and that may be partly our failure. I think one of the things that's happened at previous COPs is that interest groups have tended to talk to each other. We've been, accept this, we've been criticised as health activists for, talking to the converted. I think we all find more comfort doing that, and so we know we need to do better to publicise this way outside the healthcare community. So the answer is slowly, but not as much as we would like.
Okay, that's great. Thank you very much. It's been very clever.